Hey guys, in this video let's see an important topic for both INICET and NEET PG, which is metabolic disorders of the bone. What we will do is in this video we will compare the three most important and the most frequently asked disorders of the metabolic disorders of the bone, that is osteoporosis, osteomalacia and osteopetrosis. We will compare these three disorders on 5 points, which are pathophysiology, serum markers, clinical presentation, X-ray features and treatment. So in this way we will compare totally studying 15 points which are commonly asked based on these topics. So before going to the table, let's see an important basic concept of how we will be approaching these three topics. So basically, just like this wall here, which is made up of bricks and the cement which keeps the bricks together, our bone is also made up of minerals and osteoid. Osteoid forms the basic framework of the bone, whereas the minerals keep the basic framework together. So minerals which are commonly found are calcium and phosphate. Osteoid is further made up of cells and protein. The main important cells of the bone are osteoclast and osteoblast. Okay, osteoclast function is to resorption of the bone. Osteoblast is to form the new bone matrix. Okay, so mostly the disorders will be revolving around these two things, which are minerals and osteoid. So now, since we know that the defect in metabolic disorders of the bone can either be in the minerals or in the osteoid, let's see these three disorders in which aspect they have got the defect. In osteoporosis, if we see, it's a disorder which is seen in elderlies. In elderlies, there's decrease in both minerals as well as the osteoid. It means there's decrease in overall bone mass. So ultimately, what we'll see is the ratio remains the same. So the serum markers, that is calcium, phosphate and alkaline phosphatase, all remain normal. This is a very important question. It was asked 2 to 3 times before and will be asked in the future, that they'll say a 70-year-old female, postmenopausal female, after a trivial fall suffered a vertebral fracture. What will be the most likely serum marker profile? So they will give calcium is elevated, phosphate is elevated, or it can be normal, or they can give it as decreased levels. So you have to take the normal value. It's very commonly we will take the option which will have serum calcium as low and phosphate as low, but the answer is calcium and phosphate will be normal in case of osteoporosis. This is a very important point which we have to remember. So that's the thing. In osteoporosis, there's decrease in bone mass. That's why for investigation of choice in case of osteoporosis is DEXA scan. Okay, this is also an important MCQs. Remember, osteoporosis, there's decrease in bone mass. Okay, that decrease in bone mass is detected by DEXA scan. Okay, what does DEXA scan do? DEXA scan determines the bone mineral density, which is decreased in case of osteoporosis. So the diagnosis of osteoporosis is made when the T score, which is basically the standard deviate Z score, is less, which we read in PSM, when it becomes less than minus 2.5, it gives a diagnosis of osteoporosis. When it is between -1 to -2.5, it is basically osteopenia. If it is less than 0 to -1, then it is normal. So the things which we have to remember till now which we have seen is osteoporosis. In this, there's decrease in bone mass. The serum markers, the calcium, phosphate, alkaline phosphate are all normal. And how will we diagnose it? We will detect the decrease in bone mineral density by DEXA scan, and the T score less than -2.5 is diagnostic of osteoporosis. Okay, so I have already told you the clinical profile. It will be a postmenopausal lady complaining of pain after trivial trauma. Obviously, it will be a compression fracture. The most common sites of compression fracture will be vertebrae, neck of femur fracture. They will mention in the question that there will be an intertrochanteric fracture, which is the IT fracture, or there can also be a distal radius fracture. One thing to remember is these are all weight bearing areas where the transmission of the weight happens during mobility. Okay, so the common X-ray findings are codfish appearance, Douglas hump. Okay, the codfish appearance usually looks like this. Okay, the thing is, codfish appearance is found in both osteomalacia also and osteoporosis. If both are in option, we have to go with osteomalacia. So that is not an important thing. The 5 points which I would like you to remember about osteoporosis is, in osteoporosis there is decrease in bone mass, calcium phosphate is normal, diagnostic investigation of choice is DEXA scan, in which bone mineral density is reduced. Most common site of fracture is vertebra, and the drug of choice for the management is bisphosphonates. This is a very commonly asked question, that is, what is the drug of choice for osteoporosis, which is bisphosphonates, and they will also ask the mechanism of action. It is inhibitor of the mevalonate pathway. So we have studied 5 important MCQs of osteoporosis. Decrease in bone mass, calcium phosphate, alkaline phosphate is normal. These are compression fractures. Decrease in bone mass detected by DEXA scan. T-score less than minus 2.5 is diagnostic of osteoporosis, and the drug of choice is bisphosphonates. You have to remember these 5 points. You will not miss a question on osteoporosis. Similarly, osteomalacia. When you compare osteoporosis, which was decrease in bone mass, in osteomalacia there's only decrease in calcium and phosphate. Our basic framework, the osteoid is normal, only the calcium and phosphate is reduced. So it becomes an easy question when they say an old lady having back pain at neck of femur, at olecranon, at ribs, the most common site being pubic rami. Okay, they are talking about osteomalacia. Osteomalacia, if they want you to tick osteomalicia's option, they have to give loser zone, or it's also known as milkman's line or pseudofractures. Basically, these are the zones where there's decreased mineralization. So they will give you a image which shows this loser zone or the what we say milkman's fracture, which are the areas of decreased mineralization. The bones become more softer. Okay, so another finding which is famous with osteomalacia is orthopelvis. In this, the femoral head goes within the pelvis along with acetabulum. So in this image we can see the normal position of the femoral head opposing the acetabulum, but in this case you can see it is going within the pelvis. So they can also give an image based question based on orthopelvis, and they will ask you orthopelvis is seen in which condition. Okay, they can also give you the match the following question that orthopelvis is a feature of osteomalacia. In this, since we know that osteomalacia is a disease in which there is decreased mineralization, so we have to supplement them in the form of calcium or vitamin D. So osteomalacia, if they want you to take osteomalacia as the answer, the question will be very easy. They will mention loser zone. Okay, the most common site being pubic rami, there's decreased mineralization, and the treatment will be calcium and vitamin D supplementation. Okay, the third disease which we are studying is osteopetrosis. In osteopetrosis, mineralization is okay, but defect is with the cells. There's decreased osteoclast function. In osteopetrosis, there's decrease in osteoclast function. We know that osteoclast help in bone resorption. Okay, osteoblast help in bone formation. But when the osteoclast function decreases, automatically osteoblast function increases, and there's deposition of normal bone, excess deposition of normal bone. So what happens is, obviously we know there's nothing defective with calcium or phosphate in this disease, so calcium phosphate will be normal. Okay, so again, if we compare these three disorders, if they give you a question based on this clinical profile, and they ask you based on the serum marker level, you see calcium phosphate, alkaline phosphate is normal in osteoporosis as well as petrosis, but it is decreased in osteomalacia. But the clinical profiles of osteopetrosis and osteoporosis are entirely different. It's basically a genetic disorder in which the normal red bone marrow is replaced by a thick dense bone, because the bone is not getting remodeled, the bone is not getting the shape, the bone it is not getting resorbed, there's excess deposition of the normal bone even within the red bone marrow. So the cell lines do not develop, the hematological cell lines do not develop, the RBCs, WBCs, platelets do not develop. So what happens ultimately, there's no WBC there, so there will be infection, there's no platelet, so there will be bleeding episodes, ultimately there will be pancytopenia. And the clinical scenario, you can't confuse saying that the calcium phosphate is normal in osteoporosis also, and it is also normal in osteopetrosis, but the clinical profile, osteoporosis will be a postmenopausal old lady with pain at the site of compression fractures like vertebral neck of femur following up trivial trauma. But in case of osteopetrosis, it will be an infant. It is a genetic disorder, an infant presenting with multiple bleeding episode, infections. So that will be the clinical profile in case of osteopetrosis. And in this case, the X-ray features will be like endobone sign, Erlenmeyer-Flass deformity, Ruger-Jersey deformity. Everything, any X-ray sign which you will see in osteopetrosis will be based on excess deposition of the normal bone. Like in this case, the upper and the lower portion of the vertebrae, there's excess bone deposition leading to Ruger-Jersey deformity. In this Erlenmeyer's deformity, there's excess deposition of the normal bone in the lower part of the femur. This is the basic Erlenmeyer-Flass. The bone looks like this, so they have named it as Erlenmeyer-Flass deformity. And obviously, when there's excess bone deposition within the bone marrow, the cell lines are getting affected. So the treatment in this case will be bone marrow transplant. So like this, usually we have to study like this, where we compare three disorders which look like similar, but there are certain differences on basis of which we can compare them and remember them and have a better recall in the exam. So if we want to summarize the things, I would like you to remember osteoporosis, there's decrease in bone mass. Okay, there's decrease in both osteroid and minerals. Serum markers, calcium phosphate normal. Diagnostic investigation of choice is DEXA scan, which detects the decreased bone mineral density. Less than minus 2.5 is diagnostic of osteoporosis. Drug of choice is bisphosphonate. Mechanism of action, inhibitor of the mevalonate pathway. Osteomalacia, there's decreased mineralization, calcium phosphate decreased. Buzzwords in the exam will be loser zone, milkman's line, pseudofractures, most common site, pubic rami. Fish mouth appearance, you go with osteomalacia more than osteoporosis. X-ray feature, orthopelvis, calcium vitamin D supplementation. Osteopetrosis, in the exam, infant with bleeding episode with infection, showing sclerosis of the bone, represented by Rugger Jersey deformity, Erlenmeyer-Flass deformity, so osteopetrosis. If they ask you the management, it is bone marrow transplant. So this is a video comparing these three disorders. I hope you liked the video. If you want other topics also to be covered in tabular formats like this, you can write in the comments. Regarding me, I have already cleared these exams. I am a resident at AIIMS currently. I have studied like this only. That's the reason I am at AIIMS right now. I have got under 400 ranks in both NEET and INICET. So I can help you with making the topics easier so that you have a better recall in exams. You can see these videos when you're chilling, when you're not studying, but you still want to brush up the things. This is where this kind of videos helps you. Hope you liked it. Please tell me other topics which you want to study. Thank you so much.